what do I do? Naturopathic doctors are primary care providers in Ontario, so we have similar education, training, and scope of practice to family doctors. We run blood work, we convey diagnoses, we do physical exams, all the really boring stuff. And in Ontario, we don't prescribe pharmaceuticals. In other jurisdictions, we do because we have the training to, but Ontario legislation is archaic. Hopefully that will change soon. So I sort of fell into working with, I'm going to use the umbrella term that Alex described. I'm going to use trans as an umbrella term for transgender, transsexual, genderqueer, gender variant, gender dependent, all of those things. It's just much shorter to say. So I sort of fell into working with the trans community in healthcare. As a cisgendered queer woman myself, sitting in medical school, I didn't think that that's sort of what I was going to be doing a lot of in my clinic, but based on some of the friendships and relationships I had while I was in school, I noticed there were big gaps in healthcare and the service provision for transgendered people. And I thought, hey, I could probably do something about that. Where do people turn for healthcare? Where do people turn for gay-friendly healthcare? Where do people turn for trans-friendly healthcare? And I thought I could be of some use. So I went to all the conferences all over the place and educated myself to the best that I can. I've been at Philadelphia Trans Health Conference that Mickey was talking about. I've spoken at Southern Comfort Conference in Atlanta. The biggest trans health conference in the world is in Atlanta, Georgia. How awesome is that? And it was great, and it's been wonderful being able to fill those gaps for some people. So probably some of you are thinking, well, what does she do if she can't prescribe hormones? How is that useful at all? So a lot of what I do is helping people to navigate the healthcare system. It can be very difficult, and other physicians don't always have the time to help their patients navigate the healthcare system. It's a very stressed healthcare system, and doctors are very busy. I have the luxury of taking half an hour or an hour with my patients or whatever they need. So navigating the healthcare system is helpful for some people who are having difficulties. Some other issues that I deal with in my clinic are folks who perhaps don't want to take hormones or can't take hormones for medical reasons. Perhaps they desire more of an androgynous genderqueer appearance. And in those cases, we can use herbs that mimic estrogen or testosterone or whatever the goal is we're going for to increase their levels in their bodies, and they start to see some changes that they like, which is great. The other thing I do a lot of, I would say most of the trans care that I do in my clinic is surrounding helping people with the side effects of their hormones or other medications for that matter, because some people would prefer not to take other medications for the side effects of the hormones that they're on. And that's probably where I do my best work, is in helping with side effects. So for instance, somebody comes in who's been taking testosterone for a year and a half, and their depression has been exacerbated, and they have acne, and they're very self-conscious about their skin. Those are areas that I can work with very effectively, and it prevents somebody whose liver is already under a little bit of stress from having to go on heavier medications for these issues. So that's a large part of my practice. And I do, general sort of trans wellness and physical exams and things like that. It's nice as a trans individual, or so I've been told, to show up for a physical exam where you don't have to explain yourself. That's kind of a nice feeling. You don't have to explain yourself, you don't have to defend yourself. So that I create that sort of environment, and within the naturopathic field as a whole, I've been helping other clinics and other colleagues of mine have more inclusive policies and procedures and paperwork. Oh, so much paperwork. But as a gender variant individual who sits down in an office, and on the medical intake form you're filling out can be very limiting. Circle M or F, and then all of a sudden you don't even really want to see this doctor. So I've sort of consulted with other people in the industry to make their policies and clinics and forms more inclusive. naturopathic medicine seems to attract people with very open minds, which is awesome. It's just, if you don't have the information to make those changes, you don't know to make those changes. So I haven't had any objections, certainly, which has been incredible. So that's a little bit about what I do in my medical practice, and by no means do I exclusively treat the trans community, but they seem to come through my doors seeking services, that's all. So I'm happy to be there, and then on a part-time basis, I'm at My House Rainbow Resources of York Region as a program coordinator there. We run programs for the LGBTQ community as a whole. We have 2 youth groups, one more of a social group, one is sort of a more support-based group. We host the York Region GSA for kids that don't have GSAs in their schools, or kids that want to join another GSA. And we have groups for adults who are struggling with coming out, things like that. We host the PFLAG meetings as well. I'm on the board for PFLAG Canada York Region as well. So I wear many different hats. Luckily my offices are right across the street from each other, so it's very easy. My clinic is right across from my house, and I just walk across the street and do what needs to be done. But I am only one person who's making small changes here and there. Some of them are bigger than others. Some changes are bigger than others, but if we can all make small changes within our respective areas of interest or areas of work, it's going to be a much more inclusive environment for the people we are trying to provide services for, or whoever we're trying to provide services for, whatever their gender presentation is. And that's, I think, all I really have to say.
Thank you.